Hi YouTubers, it is Erica, also known as the Sassy Mom 82, and I just came back from my pre-op appointment. My pre-op appointment was this morning at 10 o'clock, and I met with the post-op nurse who will be looking after me along with the doctor post-op tummy tuck, and she spent about an hour and a half with me to go through, what to expect, what to do post-op, the scripts, what to take and what not to take before surgery. So, wanted to share all that with you. I got my scripts. I got 3 different scripts. The first one is Percocet, which is also has acetaminophen in it, and I'm supposed to take it every 4 to 6 hours as needed for pain. Second one is Zolfran, which is an anti-nausea medication, and also Dulcifed, Duracef. That's my antibiotic, and I need to start that a day before surgery, so I'll start that Sunday morning, and then I don't have to take it the day of surgery, since I'll be getting antibiotics through my IV. I am still scheduled for March 25th. I have to be at the surgical center at 6:30 in the morning. Very early. I'm not a morning person. So this will be interesting. And on top of that, on an empty stomach. Surgery will start at 7:30 in the morning. So we need to leave my house, which is in East Orlando, I guess like at 6, no later than 6 o'clock in the morning. It takes about a half hour to get there. I also have to do some lab work, since I am post-gastric bypass. I need to do some lab work for my H&H, which is hematocrit and hemoglobin, and also PT and PTT, which is to check my clotting, to see how I clot. I got a whole folder full of stuff. It says directions to the surgical center. I got a whole pack on drains and how to record and when to record it. So this is the sheet that I'll be recording, or my husband will be recording, the amount for both the drains. It explains a little bit about the drains, if you can see a picture of it. These are the drains. I'm going to have 2 of them, and it explains how to empty them, how to measure them, how to milk them also, and how to clean the drainage sites. I also got a welcome to your post-operative appointment, caring for your scars, what to use, the emotional and physical reactions from plastic surgery. So there's a whole bunch of little stick figures and diagrams about the emotional aspects of having plastic surgery. So I'm reading through all of that. Local anesthetic and discharge instructions as you will heal, post-operative care and for outpatient surgery and overnight patients, and also preparing for your surgery. So I cannot take any aspirin, I cannot take any ibuprofen, I have to stop my multivitamin because it has vitamin E, which is a blood thinner, and I can still take my B12 shots and my iron. Since I'm anemic, I need the iron, and it doesn't affect anything, for surgery. So that's good. I can only take Tylenol for headaches or whatever as needed. I asked her about scar therapy, and she said this stuff was really good for scar therapy. It is called Skin Medica Scar Recovery Gel with Centoline, and this is really expensive stuff. It says after using Skin Medica Scar Recovery Gel for 6 months, 80% of patients saw a reduction in size, shape, and texture of their scars. So that's what the bottle looks like. I asked her about Mederma and bio oil. She said this stuff has been proven to work better. and you only need to buy one bottle, as opposed to buying several bottles of the other stuff. So, this is $101. But you can find it on eBay for 1/8 of the price. So there's some, you know, people who've had scars and what they look like 6 months later. So, I mean, there's a pretty good, significant difference. So, I'm probably going to buy it on eBay and try it out. She did say she was going to give me a tester size. I'm going to take the tester and then probably buy it on eBay. Again, this is what the bottle looks like. And it's 2 ounces. I think that's the tester size. But she said you'll only need very little. Also got this. It's a tummy tuck pamphlet. Tells you all about the procedure, you know, what will be done, the healing process, what to expect. And I think that's pretty much it. She answered all my questions. I can take a shower 2 days after surgery. So excited about that. No idea how excited I am. I have to wear my binder 24/7 for the first 3 weeks. And I'm going to be given 2, and it was included in the price of the surgeon's fee. So the binders are really expensive, apparently. And they're giving me 2. So I was really happy about that as well. I am scheduled to go see my nurse after surgery. The date is March 29th. So it's 3 days post-op, and then I'm scheduled to see my surgeon April 4th. And she said hopefully I only will have to keep the drains in for 1 week. Sometimes patients need more than 1 week, depending on how much I'll be draining. And since I am post-gastric bypass, my vessels are much larger than the average size person, because when I was 300 pounds, the blood vessels had to enlarge to accommodate all the extra mass. So, and they don't shrink back, they stay large. So I may have extra drainage fluid. Hoping that I won't, but going to expect the worst. Made my full payment. Very, very big full payment. And it's set. 2 weeks from today, I will be on the flat side. I will not have this huge overhang of belly. So I'm excited. It's becoming more real. She also took pictures. She took front view, side view, and a 45-degree angle view on both sides. So I asked if I could have copies of those after surgery, and she was really nice, and of course, you know, said yes and answered all my questions. She said, don't hesitate to call. So I'm very, very comfortable with my surgeon and my nurse, and I know that I'm in good hands. The next time I will be making a video will be I guess the day of surgery, if not the night before. And then my husband will be in charge of videos the first 3 or 4 days, depending on how well I do. I guess that's it. Any questions? Go ahead and post them below. And don't forget to subscribe to my channel to get updates. And all I can hope for is happy healing. So prayers and good wishes are more than welcomed. My whole, reason for doing these videos is that if I could help one person, male or female, decide to make the change for them, for their, for their inner self, then my work was totally worth it. And I can go back and look at my befores and afters and have it documented. So, to all those who are thinking about tummy tucks, I am excited to go through this journey and have you watch. And to all those who've had or who are already scheduled, happy healing, and I will see you all soon. Bye!